Thank you, Dr. Bluestein, for being here today and for speaking with us. I would love to learn more about your collaborative efforts and your efforts into continuing medical education for proprietors. Can you tell me a little bit more about that?
Sure. So I was involved first many years ago with continuing medical education, abstracting articles on a monthly basis and doing recordings. That was back when we were using CDs and things like that. But most recently, I wrote an article for the journal Topics in Pain Management on pain management in hypermobility disorders, frequently missed cause of chronic pain. And I've gotten a lot of really great feedback from that. And subsequent to that, I got very involved with the EDS Awareness organization. It's an international nonprofit. And we came up with a free online CME program that's fully sponsored by EDS Awareness. And it's exciting because most physicians, they certainly can't go to conferences for each of the disorders that they see or, conditions that they treat and that kind of thing. So this allows them to, at their convenience and without any charge whatsoever, to watch some programs that give them some more information about EDS and related disorders, which are connective tissue disorders, hypermobility disorders, and it basically is a way to help them gain some information and some insight and make it more likely that they will actually catch that patient in their practice and make the connections and, make it more likely that they would come up with, well, I wonder if this could be what's related to this person having all these different problems that sometimes seem unrelated and unconnected.
Well, I can't thank you enough as a patient, not only as a patient, but as somebody that works in the community, that it's so important for continuing medical education. EDS Wellness had held a continuing medical education or physicians learning conference last year. And it was wonderful because we were able to submit for CMEs as well. And we were approved for 15 CMEs for our first official physicians learning conference. We had done a lunch prior, but we were approved for 15 CMEs for just that first conference. And I think it's a true testament to not only the need, but the work that organizations like EDS Wellness, as well as EDS Awareness, EDS Wisconsin, and others are doing, and the importance of working collaboratively. And it's not just about putting CMEs online. It's not just about having CMEs in person. It's about trying to make as much effort as possible that these activities are available,
right?
CME or not. But I just, as a patient, I totally appreciate your willingness to work with John and EDS Awareness and put this together. And I look forward to hopefully working with everybody in the future. But can you tell me a little bit more? You mentioned working with John, you mentioned CMEs and your history and working with them before, but can you tell me more about your collaborative efforts? You've talked a lot about that before, and I wanted to make sure that we spent some time on that.
Sure. So John Furman was the first person that I really got connected with in the EDS world, I would say. I watched one of the webinars that he has for patients and then I had sent him an email, and that led to a series of extensive conversations. And he had this idea of having, the first ever online CME program. And he's done a fantastic job of, he leads that program. And we have currently 4 speakers, 4 different sessions. And like any other CME program, there's objectives, and then you watch the lecture, and then you need to answer questions afterwards to make sure that you understood the content. And John's done a fabulous job of pulling all that together and getting, the leading experts in the field to give those presentations because, clearly, I mean, for me personally, I always prefer in-person education whenever possible, but it's hard to get to those things.
You can't always travel everywhere,
right?
Especially when you're in Wisconsin.
Especially Wisconsin.
Even if you are fly in, fly out, I mean, it's hard. I mean, providers have families and they have jobs, right. That is very serious, and they're taking care of patients, and it's hard to give up a weekend,
right.
and to go. So online CMEs are great, and it's important to also recognize that the approval process for online CMEs is different. It's a different submission process. I know that when I've submitted for online CMEs for approval of just the conferences from the Physicians Learning Conference that I held in June, it's a different submission. I have to resubmit it. It's just because I held it live doesn't mean it's approved for online. as
Sure.
you said, there's quizzes and different things and ways that they do checks and balances.
Right.
And you also are involved in EDS Wisconsin. Can you tell me, and you're on our medical board, which we appreciate.
Yes.
So can you tell me a little bit more about EDS Wisconsin and working collaboratively together with other organizations?
Sure. Well, it's exciting to me that EDS Wellness, EDS Wisconsin, and EDS Awareness work so well together. And I love the HMSA, which is another fantastic organization. And I know you work really well with them.
Yeah.
Dr. Hakeem is also somebody that I very early on, I sent him an email and to get copyright release for something that I wanted to use in my article. And I thought, somebody from his office might get back to me, in a few days, whatever, but he responded to me on a weekend, and that led to some really great conversations. And Tammy Kosbob is the president of EDS Wisconsin, which is a quite new organization, actually, about a little less than a year old, actually. And she's already done a lot of really great things with EDS Wisconsin. It's really been a great support for a lot of people. And I think, it's wonderful to see organizations working together. I don't know, last year, I know that at the end of September, I believe it was, the HMSA and the EDS UK held a joint conference.
Yeah, they did. Focused on living well, just like Wellapalooza, which was so great.
Exactly. And I think that's really exciting because I think whenever organizations can work together, we're stronger together than we are separately. So I was really excited to see that they were able to accomplish that last year.
It is. And as I said in the last, I've said over and time and time again, it's not even just working together with other EDS or EDS related or hypermobility related organizations, but it's also working together collaboratively with public health organizations, with organizations that focus on comorbid conditions, chronic pain. And those resources, I'm a person that believes in not recreating the wheel.
Right.
And if another organization is doing something well, I'm going to send patients to that to that website and those resources, and then say, hey, I noticed you have some wonderful resources. Can I help you add to it? This is what I have to offer. This is what we're doing. Because not one organization in our community can take on everything. I mean, it would be nice, but the idea of fostering a cohesive and collaborative unit is for everybody to pick their strengths and weaknesses. And I know purposely when I founded EDS Wellness, my focus was on restoring function and living well. And that was what I believed in, but it was also not really being done. And because we were working on other things that were important, like research and all these things, that's where my education was with public health and developing programs. But I also was very comfortable developing continuing medical education because that's what I've done since I got out of college too. So that was my focus. That was my purpose. It was trying to fill a niche that wasn't being met. And similarly, and working with the Hypermobility Syndromes Association, and in the UK, their mission and vision is very similar too. So it's been working out very well. And they have a wealth of resources on their site too.
Yes.
And we need research and we need awareness, but we also need to help people live well now and restore function. If they don't have a provider, they can't provide a provider. I have people that, I'm sure you're the same, that email me from different countries and they have nobody. So I look at it as a risk benefit ratio. If I give them a little bit of information and, or are they going to wait 5 years for somebody? They can't. They need something. I know Tammy, I've worked very closely with Tammy too. We met her at Wellapalooza and she was wonderful. And she really feels strongly about also putting together like more smaller online support groups for those people to make sure that we are really trying to reach as many people as possible. And that's essentially the focus of EDS Wellness, but also why I really believe in going virtual essentially and focusing on ways to broadcast and reach as many people as possible virtually so that they know they're not alone.
And you and I both know that there's so many people that literally cannot leave their homes or have great difficulty leaving their homes. And I think it was the second EDS Wisconsin open meeting that Tammy had. This was maybe August of last year. And there was somebody who was joining us via Google Hangout. And they were literally in their bed. And this was a young person. And towards the end got very emotional and said, I have felt so alone this whole time. And now today, for the first time, I don't feel alone. And I thought, wow,
very impactful. I mean, I've spent probably about 2 years really investing and researching and learning how to go broadcast virtual, because it's not just about doing this we didn't have Zoom a couple of years ago, but it's not just Facebook Live. It's about having to develop, meetings where people can come together. It's privacy. It's some Facebook Live. It's different broadcasting platforms. It's equipment. It's microphones. It's then going a step above and doing real recordings and conferences and virtual conferences and doing them well. It's internet. It's all these things. But that's how we can reach people, because at the end of the day, a lot of them still have smartphones, and not everybody, but the majority of our population a lot of them are online too. But being able to reach them and, them join Google Hangout or in a Zoom meeting where they feel safe is so critical.
Right.
And I love that. I love being able to provide the information virtually recorded. And we just launched this e-learning platform, but also really work on virtual conferences and having live attendance. And that's a whole other ballgame, but we're getting closer to it. So it's very exciting, so people don't feel so alone. And I think it's also important to recognize that the importance of the CMEs, the importance of being able to reach people and also work collaboratively, is because, as I call it, the EDS spiral is real. And years ago when I termed it, we didn't have a whole lot of research on it. It was just kind of a phenomenon that I saw in myself and other people. But if we can help people against the deconditioning spiral, and I'm even careful when I use that word because there's so much more that goes into it than just movement, but it really is a multi-systemic phenomenon that happens.
Yeah.
And there are things that people can do to help themselves when they're equipped with the right information, even just a little bit. Even I made a video with doing, exercises in bed, but then if you take it one step further and their provider has a little bit more awareness of what's going on, it's through a CME or a lecture that they went, it's just amazing what can happen. And that person now went from feeling totally alone and helpless and hopeless to having hope and finding connection and doing something, and they feel empowered, and then they have a provider to help them.
Right.
So is there anything that you would like to say last before we get off? We appreciate your time and speaking with us. Do you have anything more that you would like to say about collaboration or continuing medical education for providers?
I think just two things. One is that when something is CME accredited, like you said, it has to go through extra measures to show that the speakers are, being objective, and they have to disclose any conflicts of interest. And so that is an additional bar that has been met over and above if you have some program but it doesn't have CME accreditation. For me as a physician, if I am choosing between two things and one has CME accreditation and the other one doesn't, I'm always going to choose the one that's CME accredited. Because
that's right. Even if you don't necessarily need the CMEs, I think that's a very important point.
Absolutely, yes.
And even for patients to understand too, because there are a lot of people with a lot of information out there, blogs, different things like that, and it's hard to understand which information. There's a lot of misinformation, a lot of lack of awareness, different terms being used, and to help people or providers find the right information to follow. That makes a good point. So thank you.
Right. So that's one thing. And the other thing was, I just wanted to emphasize again how wonderful, I feel so thrilled to be working with you, because I love your philosophy, the wellness philosophy, and because it's easy to, when you have something wrong with you, to focus on what's wrong and not focus on what's right. And when people have things like EDS or related disorders, there can be a lot of different challenges that they face. And I find, especially with patients that I have, it's amazing how some people can really still focus on what they have to be grateful for. And I really think that serves them very, very well in their journey. And I think it's so much more healing to be able to focus on what you have, what you're able to do, rather than what you're not able to do.
And in a lot of ways, it's a learned trait. I wrote an article called I Changed My Negative Nelly DNA. That's because I was a negative Nelly, but it takes practice and it can be done. But also talking about healing and not necessarily, you can't changing your DNA. I'm not saying that from a mutation standpoint, but we talk so much about what's wrong and how to find it and awareness, but we also need to talk about how patients can get better so that they believe that they can. I think that was also missing. And I like to focus on that, making them really feel you can get better. I don't know exactly the right way, but I'll walk that journey with you, and
Right.
we'll be here to help you and provide resources. But it's a roller coaster, and let's just equip you for the best ride and the best way to ride. And it'll go up and down, but we'll be here to walk that journey or ride that ride with you, and empower you with the right tools to take more control of your health and your health care, and not feel so alone.
Absolutely.
So thank you very much for your time. It was
Thank
wonderful
you.
to spend time with you, and I really appreciate everything that you're doing. I look forward to seeing you in person. Thank you so much.
Sounds good. Thanks, Kendra.